In early cancer research, we've focused on achieving the largest appropriate dose without significantly observed toxicities, but now we're finding that often less is more. In general, you give a lot lower of a dose for a longer period of time, and that sometimes, based on the research that's available right now, has often a more potent biological effect than just giving a larger dose of the same treatment.
Joe, welcome back to the show.
Hey, Siim, how's it going? Thanks for having me.
Yeah, I'm excited to have you back. And for those of you who don't know, then Joe and I did our first podcast last year where we discussed the main fundamentals of cancer biology. How does it work? What are some of the things you can do to prevent cancer and reduce the risk of developing cancer? But there's obviously a lot of questions that were left unanswered because cancer is a super complex topic. And that's why I decided to have you back. And I actually let my audience ask you some questions. So we'll go through some questions that they had. But before we get to that, the first podcast we had was not 1 year ago, but let's say 10 months ago. Mm-hmm. Have there been any new insights in cancer research that you've come across, or has there been any changes in your own way of thinking about cancer and cancer prevention?
I mean, cancer research is an ever-growing field, so there's always things we learn even on a regular daily basis. From like an advanced therapeutic perspective, there's obviously been a lot of advances when it comes to immunotherapies, which are types of therapies that can basically make your immune system stronger or more capable to recognize tumors. And I think we touched on that briefly in the first the part one of our discussion here. But more so in an area that I am focused on regularly because it's my job essentially is targeted radiotherapy. So my company that I work for specifically, we attach radioactive isotopes to basically these small proteins that we design to bind to a specific thing on cancer and that's not present on normal cells, to basically deliver a radioactive missile or nuclear warhead directly to the site of a tumor as opposed to systemic radiation. So there's been a lot of advancements in terms of developing radiotherapies to be targeted in my specific area, and a lot of therapies are in clinical trials right now to target various bladder cancer subtypes, liver cancer subtypes, and breast cancer subtypes as well, and also some lung cancer types for targeted radiotherapy. But another type of immunotherapy is it's called an ADC. So it's an ADC type therapy where you basically have an antibody that is attached to or chemically linked to, instead of like a radioactive isotope, it's chemically linked to a chemotherapeutic. So it's another way of delivering a targeted chemotherapeutic directly to a tumor site, kind of like the way that we would use targeted radiotherapy. So those are some advancing fields that I think are pretty important to pay attention to. So if people want to dig more into ADC type therapies, that's ADC type therapies, or targeted radiotherapy, I would advise that they look into that. And obviously we can have a part 3 through 100 to discuss the various nuance to be discussed here. But those are some promising fields that I think people should look into.
Yeah, it's funny that you mentioned the radiotherapy. A few months ago, I stumbled across this boron neutron capture therapy, which essentially is also you ingest this boron 10 that's, I guess, also like allows neutrons to hit it. So then boron 10 migrates to the cancer cells, and then you have some high energy particles targeting that tumor, which also works like a nuclear bomb in your body that targets the cancer cells.
You'll have to send me that information because I'm not familiar with that specific type of therapy, but I'd be very curious to read about it. It's a huge field.
It was a new paper, I think, a few months ago that I found.
Okay.
But you also mentioned this immunotherapy, which over the last few months or years, there's been some of these insights that the timing of when you do chemotherapy or when you administer chemotherapy appears to have pretty big effect on the outcomes and the effectiveness of the chemotherapy through like the circadian rhythm regulations. So like the timing of when you actually quote unquote, do cancer therapeutics
Mhm.
appears to matter as well.
Yeah, there was a recent paper that came out that had discussed obviously the circadian components associated with when to administer immunotherapy. And it appears, based on the research, that the best time for a cancer patient to receive a specific type of immunotherapy would likely be towards the morning to the afternoon. Um, but
Mhm.
I've had some hit back or some blowback with this because I've been speaking to a lot of my colleagues about this, and clinically, it's very difficult to schedule uh, a patient to receive those treatments in the morning because obviously patients they have jobs, sometimes they often have to travel to a specific site to receive therapy, and it's often very difficult to control whether or not they receive those
Mhm.
therapies in the morning, despite what the research says. So there's some hurdles we have to overcome there in terms of trying to achieve an optimal response. And there's also been a lot of work done, and it's funded by the National Cancer Institute and the NIH here in the United States to better understand the relationship between dosing and treatment efficacy. So, in early cancer research, we've focused on achieving the largest appropriate dose without significantly observed toxicities to be able to achieve an effect in terms of reducing cancer growth. But now we're finding that often less is more. So we're dialing back on the overall dose that we use to achieve the minimal effective response, such that you exhibit even less level of a toxicity. But in general, you give a lot lower of a dose for a longer period of time. And that sometimes, based on the research that's available right now, has often a more potent biological effect than just giving a larger dose of the same treatment for a shorter period of time. And this is often true for
Mhm.
immunotherapies as well. So we're learning to reduce the dose of immunotherapies and give it a lower dose for longer periods of time to have a sustained immune response against a tumor versus increased likelihood for um, basically your body will make antibodies against the antibody that you're giving to get rid of it. So if we give a lower dose, it's going to decrease the likelihood of your immune system to target that thing, and it'll increase its availability and circulation to kill a tumor. So that's
Mhm.
called
Okay.
Project Optimus, actually, which is kind of funny.
Right. Yeah. Before we get to the questions, there's another thing that I remembered. So I think maybe 1 or 2 months ago, there was this paper that linked being close to the golf course, living close to the golf course
Yeah.
with higher rates of Parkinson's because of potential like glyphosate exposure or something like that.
Mhm.
And, people were very up in arms about it and, talking about, okay, move away from golf courses or don't
Yeah.
buy any pesticide grown foods or something like that. So what are your thoughts about that paper?
Yeah, I mean, there's been a lot of studies about this regarding ecological considerations from runoff through into water sources and stuff like that, into which can eventually lead into human consumption related to golf courses. My thoughts on this are that obviously there are better alternatives we can use on golf courses to try and keep them pristine. But golf courses are man-made. Like, if you want a
Hmm.
golf course and you want golfers to occupy this golf course, there's a lot of synthetic material that is needed to be able to maintain that ecosystem to be as pristine as possible. So while I don't think that it's great for the environment, in fact, I'd be willing to say that it's pretty bad for the environment. Um, there's a trade-off here regarding making an income off of owning a golf course.
Right.
But as far as it goes for regulatory considerations, I think that golf courses should also have appropriate runoff streams, or there needs to be an
Mm,
investment in a better infrastructure to enable golf courses to operate more safely, such that that runoff is less and less likely to make it into human consumption.
mm,
And
gotcha.
and
But
to be honest, like, I don't know all the infrastructure that they have available, but based on the research, it suggests that there's very little which needs improvement.
yeah, yeah. But do you think it's reasonable to, or is that like a plausible risk, like a real risk to risk of Parkinson's or something else if you're like very close to a golf course?
I think it is real. It's hard to say how likely somebody will get Parkinson's or even increase cancer risks as an example. And again, I'm not a Parkinson's disease specialist, but it depends on the golf course and it depends on how careful the people that are applying the pesticides to or fertilizers to the plants and things there and
Hmm.
insecticides and stuff like that. It depends on how careful that they are. But yeah, there's definitely a risk. I mean, there's a risk with everything in life regarding human interaction with insecticides,
Right.
glyphosate, fertilizers, and all that stuff. So people just need to be conscientious of that. And golf courses, if they want to maintain their business, they need to also be more rigorous about how they protect not only their employees, but also people that live in the surrounding communities. And perhaps maybe there should be zoning
Okay.
restrictions in place where people can't live within, a couple hundred yards or a couple thousand meters of a golf course. And there may be in many places, but here, I drive down the street and I see houses right next to the golf course. And, it's reason to believe that those people might have greater impact with or interaction with the fertilizers from the golf course than, the house that's a few blocks away.
Gotcha.
Yeah.
I don't I don't remember exactly if we covered this on our last episode, but what about cancer risk? Does glyphosate or some other pesticide exposure have a cancer risk?
Yeah. And I don't think we discovered or discussed this in the last episode, but yeah, there are certainly risks. And I made a post about this recently on my page, and I partnered with people are always up in arms about, fertilizer use and insecticide use. And as we've just noted, there's pros and cons that need to be had regarding farming practice and our need to utilize these things such that we can grow a sufficient amount of crops. Um, but the studies show that at very, very high doses, for a prolonged period of time, that of course the increase for risks of cancers goes up. So I think it's reasonable to say that, people should be washing their produce where they can when they receive it from the grocery store to try and minimize fertilizer or insecticide or pesticide consumption where possible. Um, but in general, if people are consuming a healthy and nutritionally diverse diet, their likelihood of something like glyphosate increasing their cancer risks is going to be low. It's non-zero. There's going to be some risks to it, just like anything in life. Um, but they're going to have lower risks, assuming that their diet is nutritionally diverse and they're exercising, they're engaging in good sleep behaviors, and they're not regularly consuming alcohol or smoking and those sorts of things. And I think we've touched on that in the previous episode as well.
Hmm. Yeah. Yeah. It's like everything has risk, even if you're, being alive imposes some risk, and you
Yeah.
get radiation exposure from the sun, and
Mhm.
there's all things can be carcinogenic and
Yeah.
increase risk.
Yeah.
Mm.
Exactly.
Yeah. Well, I think now we can shift to the Q&A section. We got nice questions here. And yeah, let's start with the first question. Do I really need to worry about cancer if I'm young and healthy? With mostly like the increased rates of early cancers in younger people nowadays.
Um, I think the word worry is subjective. I think that people should be reasonably cautious, and I feel like maybe that's a synonym for worrying. But I think as we are, I mean, I'm a 33-year-old male, going to be 34 this next month here, and I'm relatively young, and I think that when I was younger, I assumed that I was, kind of invincible, that there were few things that could affect me, and I think that there's there's a certain level of caution that people should be going throughout their lives, when they're younger and as they get older, because those cancer risks increase as you get older in general, just because you're aging. But I think that there should always be some level of baseline about certain um, behaviors that may be associated with risk. Like when I was an undergrad, we've all been through party stages and stuff like that too, where we're drinking with friends and you smoke the occasional cigarette or you smoke pot or something like that, or consume THC. Most of us have been there. I've been there, if I'm being honest. And you know, knowing what we know now about the relationship between the causative relationship between those behaviors like smoking, drinking, and even THC consumption in some cases, both beneficial and harmful. Um, it's worthwhile to note that we can reduce the consumption of those things now, even as we're younger, to hopefully minimize the level of risks as we get older of the impacts of those things. Of course, we can handle things acutely, right? We can handle acute stresses and acute levels of carcinogens, but it's when we consistently consume those things and interact with UV radiation, if we have, poor behaviors associated with going out and tanning, right? Like those things chronically are going to be associated with increased risks of cancers. And a lot of those behaviors do start when we're young. Like I started exercising when I was very young, and I've maintained um, the behavior and the importance of consistently exercising over time. So that has helped minimize my own risks. So I think a lot of those behaviors do start when we're young. But I don't think that it's worth worrying to the point of anxiety just because we do see increased risks of cancers, especially in younger people, specifically regarding colorectal cancer.
Mm.
And I just made a post about this as well, regarding earlier uh, incidents of cancers, because there was a new study published a couple years back that notes that. So, like, we know that certain diets are associated with increased colorectal cancer risks, particularly that within the United States currently, our food environment is not great, to say
Mm.
the least. So, if we know the specific contributing factors to colorectal cancer risks, largely regarding excessive consumption of ultra processed foods, saturated fats, a diet that's deficient in fiber, those sorts of things. If I know those things now based on the research and I'm younger, I know that I need to adopt my diet or change my diet to accommodate something that's going to reduce my risks for something like colorectal cancer that we're seeing in increased prevalence in younger individuals.
Mm.
Does that make sense?
Yeah, absolutely. That's a very good answer. And why do you think there's this increase in colon cancer? You mentioned already some of the dietary components. Is there anything else specific that you might explain some of that risk?
Um, yeah, I mean, there's also the sedentary lifestyle thing that is associated with increasing risks of colorectal cancers. Um,
Mm.
and our colon is also like an integral part of how our immune system can take care of us. So I think that oftentimes if we have bacterial dysregulation, if we're not consuming something like enough fiber, going back to that nutritional perspective, it can often be associated with what's called dysbiosis, or the microbial species, bacteria, fungi, viruses within our colon or our digestive tract um, get messed up, basically. And oftentimes this can lead to a state of chronic inflammation. Inflammation is often a buzzword that's used online, and you've tried your best, just as I do, to try and educate people about what inflammation actually is. And so that level of chronic inflammation um, can be associated with increased cancer risks over time, especially for colon cancer. Um, yeah, I mean that's just trying to keep it simple. There's also like the circadian dysregulation thing. There's a very important interaction between our gut and the way that our brain signals to our body for things like hunger and
Mm.
satiety and all those things, and also energy balance. So dysbiosis can mess up the circadian biology aspect um, as somebody develops cancer as well. So that's even something we have to be careful with when we're giving cancer therapeutics to a cancer patient, is to try not to disrupt the gut microbiota as much as possible. And of course, that's
Mm.
that's often impossible. Um,
Yeah,
those are just some contributing factors.
yeah. That's should people then start to screen earlier with the increased rates of younger people cancers?
Yeah, I mean, I think nowadays, just because of what we know regarding cancer incidence in younger people, I think that people should screen when they're younger. Maybe get their colon checked or something like that, or even something like an MRI or some sort of PET scan. But Um, I wouldn't say that it's worth doing, I don't know, before 30 years old. But if people
Hmm.
have the ability and the access, their healthcare or whatnot, to be able to get those types of screenings done when they're, 25 to 30 years old and onward, either annually or biannually, I think it's a great idea just because of what we're seeing regarding the trends. And of course, as I think
Yeah.
we've mentioned this specifically in our last episode together, is the the cancers that are easier to treat are the ones that are detected sooner. So, um,
Yeah.
I think that it's important. Yeah.
Yeah. Especially colon cancer. Like you can
Yeah.
treat it completely if you're like early enough.
Yeah. Yeah. The treatment for colon cancer when detected early is, for most cancers even, is significantly more effective than, when a cancer has come close to metastasizing or has metastasized to distant tissue.
Mm,
Yeah.
gotcha. I want to take a quick break to let you know that my Skool community with me and my wife is now live. It's called U-Span Society, and it teaches you how to look and feel younger. Both me and Inka have reached top 1% of health with our biomarkers, and we can teach you to accomplish the same, because we've already coached over 500 individuals. Here's what's inside our Skool community. 12 plus hours of video content about reversing signs of aging and becoming healthier. We're adding new content every week and every month. Video courses on nutrition, skincare, fitness, sleep, biomarkers, and much more. New courses are added every month. Bi-weekly live Q&A calls with us, where we answer your questions about your U-Span journey. An in-depth overview of our own health protocols that helped us to reach top 1% health. Community posts and discussions where you can get feedback and help regarding your progress. Full workout plans and meal plans that are updated regularly. Step-by-step walkthroughs of workouts, skincare, nutrition, and daily routines. And a WhatsApp group for daily tips and inspiration. All of this for $1 per day, and even less than that with the annual plan. Check out the link in the description or search for U-Span Society on Skool.com. Skool with a K. All right, next question. Is it true that stress or negative emotions can cause cancer?
Yeah. So I've covered this as well on my page. There are associations between how distress, negative stressors in our life can potentiate situations that increase our likelihoods for cancer. So a lot of studies have focused on the circadian aspect regarding cortisol metabolism. So chronically or chronic stress can mess up cortisol metabolism, basically, that can increase risks for something like kidney, liver, bladder cancer, and those sorts of things, pancreatic cancer as well. So just keeping that simple, yes, chronic levels of stress can potentiate situations which can create basically metabolic disbalance or imbalances between our circadian metabolism to
Mm,
increase cancer risks. There are also situations where, from a behavioral perspective, we can posit that chronic stress can lead to adopting pretty poor behaviors. So oftentimes when people are dealing with chronic distress, in this case, they'll resort to drinking alcohol to try and calm down or various medications. And oftentimes people overdo it, or even like smoking. Like I said, and those are chronic consumption of carcinogens in the case of alcohol consumption and smoking cigarettes or even THC or pot. But
mm,
when it comes to medications and things like that, oftentimes people can overdo it from that perspective. And of course, that affects liver metabolism if people are overdoing specific medications to affect their metabolic ability that makes them feel better.
mm. What about the negative emotions? So like more like grumpiness or being angry or those kind of things.
Well, if that were certainly the case, I'd probably have cancer first more than anybody, because I'm pretty much grumpy most of the time. My wife can attest to that. But I think that it's hard to say whether negative emotions are directly related to increased risks, because those negative emotions are often very important in how we cope with our reality, the things around us. And so I think that, getting into the psychological aspect, which again is not my area of expertise, but I think that therapy can be very important for people, and in particular cognitive behavioral therapy can be helpful for people to cope with those negative emotions in a more impactful way, such that they know why the negative emotions are arising, such that they can make appropriate actions for them to not be sustained negative emotions, which eventually lead to distress. I mean, we've all been in positions where we've been so stressed out, or at least I can speak for myself here, where we've been so stressed out that, that it affects our overall health in the long run. I've had extreme behaviors when I was younger in terms of being completely obsessed with, doing lab work such that I would work from 9 in the morning to like 1 at night. And I did this for years. And now, if I'm being honest, I'm exhibiting some of these effects of chronic distress and improperly dealing with my emotions. Um, on metabolic output. So my testosterone in this past year has been completely tanked. And I'm pretty sure that was a strong contributor to that was me not taking care of myself for many, many years because I was so obsessed with what I was doing that I wasn't taking care of my psychological state. So I think that
Mm.
there's important taking care of your mental health just as you do your physical health. And those have to go hand in hand, and it's very challenging. So I know how difficult it
Yeah.
is for people to deal with that just because I've dealt with it myself and continue to deal with it.
Yeah. If you look at the other chronic diseases as well, you see that loneliness or social isolation and unhappiness and depression and those things are associated with increased risk of heart disease and mortality. Other types of diseases as well. And it's kind of
Yeah,
interesting that of course, you can explain it with certain behavioral aspects. So, like people who are more depressed or unhappy, they tend to cope with more alcohol or some sweets or something like that.
yeah,
But I don't know. There might be also something actual causal there that um, you know. I guess you could create some more inflammatory state or like neuroinflammation if you're depressed or chronically unhappy or something like that associated
yeah,
isolated. Like you could probably increase some neural inflammation or some other types of sympathetic nervous system state or increased cortisol or something like that.
yeah. And it certainly seems possible. And like I said, the research that we're finding out relating cortisol to cancer risks is certainly pointing to that.
Hmm.
But as you know, it's never one thing or the other when it comes to any biological system, just because there's obviously a lot of moving parts. Humans are not, easy to understand beings regarding our overall biology or physiology. So, but yeah,
Hmm.
we're learning more and more about these links and how stress can relate to Parkinson's disease risks or even diseases like cancers.
Hmm. Yeah. Next question is pretty interesting one. What does it feel like to have cancer in the early stages? Are there any early signs people should pay attention to?
Oh, I mean, all of these are great questions so far. Let's start there. So, for those of you who are asking questions, thank you so much. They're great so far. Um, but if you're exhibiting what you think to be early symptoms of cancers, it's really hard to say what those are. Um, Something like ovarian cancer, as an example, a pretty common symptom of ovarian cancer is abdominal pain. So in females, like they have menstruation every month. And so abdominal pain is pretty common in females. So oftentimes ovarian cancer gets missed early stage because women naturally just think that it's associated with menstruation or cramping or something that's pretty common when it comes to women physiology. So that's one particular instance. So um, it's really hard to diagnose cancers when they're in an early stage just because the symptoms oftentimes are just not there, or they're so common that it's hard to say, oh, it's cancer. It's like when people go onto WebMD and they say, oh, I have a migraine and it's not going away. And the first thing WebMD says is, oh, it's a stage 4 glioma. It's hard to make a
Right.
conclusion there. But yeah, I mean, I can't give any specific advice there regarding, how to detect early stage cancers from a symptom perspective.
Mm.
Um, all I
I guess
can
like
all I can
blood in the
realistically
stool
say is,
or
I'm sorry, what?
something like blood in the stool or those kind of things
Yeah, I
tend to
mean
be
those
more
things are
serious.
pretty basic, but that could also be indicative of like a GI infection or something like that. Which, of course, depending on the infection, it can be associated with cancer risks. If it's a specific microbe that's known to be associated with gastric cancer risk, as an example,
Hmm.
um, it could just also be associated with someone pushing too hard. I've been in that situation too.
Mm.
and you create micro tears in the intestinal lining, and sometimes you get blood in your stool, or somebody's not wiping appropriately. Those sorts of things. So those are common things that are hard to miss. But if it's profuse bleeding that ends up becoming painful, yes, then it's worth getting checked out. I think in general, blood from stool, fresh blood from stool, should warrant a person going to the doctor to get checked out.
Mm.
But those are pretty straightforward and basic things that I think people already, or at least they should know. And if they
Yeah.
don't, they do now.
Yeah. Next question. You talked about muscle and survival. How much exercise is enough, and are there any like specific workouts people should do?
Yeah, so there's always a lot of debate between nutritional scientists and exercise scientists and biologists in general about this particular topic, about what the most optimal types of exercises and how often we should do these exercises to reduce risks of cancers regarding skeletal muscle, as an example. And there have been studies that show the minimum amount of exercise that you need is like something like 2 minutes per day,
Mm.
which, you know, is interesting from a statistics perspective, but I'm kind of calling bullshit on that, because 2 minutes is just not enough. I mean, unless you're doing 2 minutes of severely rigorous hit activity, um, you know, like very fast push-ups or sprinting or something like that, which most people are not doing. Like no one's
Mm.
committing just a 2-minute time block to exercising, or at least they shouldn't be. Um, but I will say that based on what I've read, I would say that anywhere from half an hour minimum, depending on the type of exercise. So if
Per week
somebody's
or
going, I'm sorry,
per day or
per day or per exercise.
okay.
Yeah. So let's say I have a specific exercise plan where I work out 4 days a week. Let's say 2 of those days I'm going for runs, right? And I'm running for 30 minutes, like endurance running. So I'm not running at a super fast pace. I'm going for like 30 minutes. Maybe I'm doing like a 10-minute mile pace, running 3 miles. That's a sufficient exercise. But then let's say the other 2 days I'm doing resistance training in the gym. And this is actually something I've done before. Um, focusing one day on upper and lower. And then the other day on maybe core strength. Um, those sorts of things can be helpful. But I would say in general, at minimum 30 minutes per exercise is sufficient for most people. Um, and of course, we can talk about frequency per week. I would say at a minimum 2 times per week. Um, but oftentimes it's dependent on people's work schedules. I know there have been weeks where I've just been so busy and stressed out that it's, as an excuse, it's affected my ability to go to the gym. Sometimes, that mental health component of just needing to go home and relax and play video games or unwind or something is often more beneficial to me than taking that time and going to the gym, where I don't feel like it's going to help as much. So there's always a trade-off with these things, but at a minimum, I think working out 2 times a week for about 30 minutes is sufficient for most people.
Mm. Gotcha. Next
But that's at
question.
a minimum.
Yeah, I think with exercise, yeah, it's something that hard to say how much is optimal. There's possibly too much exercise can possibly be harmful, but I
Absolutely.
think but the average person probably doesn't reach that.
Yeah,
So
I mean, none of
the
us
average
are.
person probably exercise is not enough.
Yeah, I mean, I'm certainly not like a pro athlete or anything like that. I find that it's hard to exercise the way that I do, at least more than 4 times a week. And I used to exercise a lot more. Depends on what I've been training for. What do you do for exercise typically? Just out of curiosity.
I do 3 times a week. 3 times a week I do like calisthenics and resistance training. So I do like push pull legs, split, and then twice a week I do some easy low intensity cardio. So cycling currently in the summer, and then maybe once a week I do some sprints, 10-minute sprint workout, or
Nice.
20-minute hit. Depends on how much time I have or
Yeah,
how I feel. I try to have like 1 day of the week for rest, and 3 days a week are somewhat harder workouts. But 3 times a week I do very light exercise.
yeah, that's great. So there you have it, guys. The Simland workout program.
Yeah. Next question: should I be filtering my tap water for microplastics and PFAS and those things?
I mean, I do just preemptively. I'm not sponsored by this company, but in the
Mhm.
United States here, we have something called HydroViv. And I don't know if they ship to where you guys are, but I certainly use a filtration system to filter out microplastics in water supply, just because a lot of water aqueduct systems utilize PVC, and over time, that PVC, which is a type of a polymer of plastic, can break down, and those fine particles can end up in your drinking supply, despite the treatment processes they go through in water plants before they're delivered to drinking water supply. So yeah, I mean, I certainly think that there's a lot of benefit for most people to have some form of filtration system to filter out microplastics, especially now since we're seeing from a variety of different research perspectives that microplastics are pretty much everywhere. So that's a very, very, very simple and really affordable thing that most of us should be doing to minimize our microplastic consumption. So yes, very simple.
Mm, yeah. What's the difference between a benign tumor and a cancerous one?
Okay, so a benign tumor is typically a piece of tumor tissue that is actively growing but doesn't have characteristics a of a cancerous piece of tissue to go beyond that particular area. So it has cancer characteristics, but they're not severe enough to the point where it can become malignant. When something is a malignant piece of tissue, it has oftentimes these hallmarks of cancers. They're genetically unstable. They have multiple different types of mutations. They have metastatic characteristics. They're showing signs of being able to move or extravasate between tissues. Um, they often have metabolic aberrations between the electron transport chain and glycolysis, as an example, in the citric acid cycle. Um, it's it's much easier to diagnose when something is potentially malignant than it is benign, just because the benign mass is something that's actively dividing. It's maybe causing some form of local issues, but it doesn't have some of those severe cancer features that you would see in a malignant or cancerous piece of tissue. Does that make sense?
Mm, yeah, yeah. And um, should they be like worried if it's spreading or growing on a scan?
Um, yeah. I mean, if you have even a benign piece of tissue that's actively growing, and you've been tracking it over time, um, then yes. So as an example, I recently just went to the dermatologist. In my family, I've got lots of moles that I've inherited through my genetics. So I have to go regularly now to get checked. And this is something I've recently started doing, and I should have done it many, many years ago in terms of getting my moles checked. So I've been watching some of these moles, in particular on my back, um, become more irregular in their shape and their melanin pigmentation. And one of them actually started causing pain on one of the back of my shoulder blades, because it was, maybe pushing on a nerve or something like that. So that's kind of indicative of this is a growing piece of tissue and it's raised now. So um, it might be benign. I'm still waiting on the results of that, to be honest. But um, those are particular characteristics I think that we have to look for in actively growing piece of tissue. And don't do like I did and wait to the last minute. Go, as soon as you start to see those particular features, try and secure an appointment to investigate potential cancerous lesion.
What about birth signs and melanoma and skin cancer? Is there any specific differences that immediately point out that this is just a regular birth sign, or and this is more malignant.
What do you mean by birth sign?
I mean, these birth spots,
Oh, yeah, yeah, yeah. No, typically those are not related to uh, cancerous pieces of tissue. Those are just kind of inherited uh, melanin characteristics associated with the skin. My sister has a couple of them. I have one of them on the back of my leg, but those I don't think there's really any reason to be worried about those.
Mm, gotcha. Yeah. Next question. Can the body ever get rid of cancer on its own?
Yeah. So there's been a lot of people that talk about spontaneous remission, which is the ability of the body to eradicate cancerous tissue on its own. Um, and the answer is yes. Um, but it's hard to say just how likely that is, just because our bodies are naturally ingrained to eradicate cells that are acting abnormally in any given area in the body. And that doesn't mean that it's cancer. That means it's something that is not working the way that it's supposed to. And that's just checks and balances that happen within the body. So we can't confidently state that that's cancer. Now, there are times where if somebody does have a cancer, they can exhibit spontaneous remission depending on the type of cancer it is, but it's not very common. And it's just not widely seen. So it's hard to say with any degree of confidence that a cancer patient can just avoid treatment entirely, um, with a strong degree of likelihood that their body will take care of it. Because in most cases, uh, often very close to 100% of the cases pretty much require some form of treatment if somebody has an active case of cancer. So spontaneous remission,
Hmm.
not common at all, and I would not advise anybody to take your chances in letting their body to eradicate something that's
Right.
known and actively dividing as a tumor.
Yeah. That's a risky business.
Yeah.
Um, Next question. Should I avoid milk and cheese?
No. No. I mean, let's keep that simple. I love milk and cheese personally, so I don't want to say this from a position of potential bias because people will claim that, oh, if I drink milk and cheese or drink milk and eat cheese, I'm introducing bias here. But like in all seriousness and being unbiased, looking at the research, of course, if somebody if all their diet is dairy, milk, and cheese, then yeah, they're going to have nutritional deficiencies. But no, they don't intrinsically on their own strongly relate to cancer risks. I think that oftentimes cheeses, there's many different diverse types of cheeses with different nutrient profiles. The same with milks and those sorts of things. Of course, pasteurized because there's this tendency for people to consume raw milk these days. But pasteurized milk is the way to go here from reduction of consumption of potentially pathogenic bacteria and parasitic organisms. But yeah, there's really
Mhm.
no reason to avoid eating dairy or cheeses,
Yeah.
assuming a good
I remember
diet.
doing some, yeah, I remember doing some research and finding that dairy consumption is associated with less colon cancer specifically. That
Okay, yeah, I mean,
dairy and
I've
calcium.
not read that per se, but I can say that if somebody is consuming a nutritionally diverse diet and dairy and cheeses are a good component of that particular diet, then it kind of makes sense that if people are consuming those things appropriately, that it would be associated with reduced colorectal cancer. It's just from like a protein perspective, and there's a lot of benefits from a probiotic perspective when it comes to drinking dairy and cheeses. You're consuming microbes that
Mm,
in general have benefits when they interact with your gut microbiota in terms of helping you digest. So that makes sense from that perspective.
mm, yeah. So maybe the best option would be some of these fermented dairy products, yogurt, kefir,
Yeah,
maybe
exactly.
blue cheese rather
Yeah.
than regular, McDonald's cheese.
Yeah. No, that's totally true. Um, that McDonald's cheese is pretty. heavily processed cheese too. So
Mm.
now it's not to say that the
Yeah.
wheel of blue cheese or other types of cheeses are not processed, but of course the nutrient composition and the microbial composition of cheeses is wildly diverse from a fungal and a bacterial perspective largely. Um, but yes, so it's safe to say that
Mm.
fermented dairy or fermented cheeses are the way to go in terms of bacteria or yogurt, kefir consumption, or even some of those cheeses like blue cheese,
Mm.
Parmesan, aged cheeses, those sorts of things. Yeah.
Mm. What about processed meats and cured meats like salami and sausages?
Yeah. So again, if a person's diet is overly abundant in terms of consumption of hyper processed meats like deli meats and those sorts of things, then yeah, you're going to have again those nutritional deficiencies that come with fixating on one particular food group when it comes to consumption, like the carnivore diet, as an example. Um, there's a lot of preservatives and those sorts of things on those foods as well that can counteract certain health processes. But if somebody is consuming deli meats, and I eat deli meat regularly with sandwiches, it's just not super often. Um, but if somebody is eating these deli meats with, a lettuce, tomato on a sandwich with light mayonnaise and, you know, a good slice of fresh bread or something like that, as a part of their diet, there's certainly no issue, especially if, like I said, they're integrating other healthy behaviors alongside consuming a nutritionally diverse diet, which can safely include processed meats, like deli meats. It just shouldn't be, as you know,
Mm.
it just shouldn't be everything that person eats. If I eat deli meat every day, I'm going to have a problem. But I can have a sandwich every couple of days or something like that,
Hmm.
alongside the other things that I'm eating in a day, as if I'm eating
Yeah.
vegetables, fruits, and all those sorts of things, or even dairy and cheese.
Mm.
Yeah.
Yeah. That's like moderation is fine, and have a more more balanced diet,
Yeah.
then you mitigate risks with that.
Yeah. I mean, I know it sounds kind of
Next
simple,
question:
and
why do some people live for years with cancer and others die quickly?
why do some people live for years with cancer and others die more quickly? Um, it all depends on the type of cancer, really, um, and the aggressiveness
Mm.
of the cancer. So, if somebody has pancreatic cancer that's detected relatively late stage, oftentimes the mortality risks associated with that late stage pancreatic cancer are very high, and those people have a very low chance of surviving more than 5 years. And it's the same with like gliomas as an example. But if somebody has like a basal cell carcinoma that they've been keeping under check, as an example, or maybe even a melanoma, um, there's a higher chance of survivability past 5 years than something like pancreatic cancer, esophageal cancer, gliomas, late stage brain cancers. Um, so oftentimes the thing that dictates survival is the type of cancer and how advanced it is. And that's pretty much true for all cancer types.
Hmm. Gotcha. Yeah, I guess the health of the individual will be a big component. If
Yeah.
you're healthier, let's say you have a healthier lifestyle to begin with, and you have better body composition and better blood markers, etc., then your likelihood is much higher to survive.
Yeah. Yeah, exactly.
Gotcha.
Yeah. It's a great
Um,
question.
yeah. Next question: how much cancer risk comes from everyday stuff like deodorant, Teflon pans, and etc.?
Yeah. And again, it's hard to say how much specific risks come from, association with deodorant and Teflon, but there are known risks between, the use of aluminum containing deodorants in particular, um, with cancers,
Mm.
albeit the risks are very low. But nowadays, there's deodorants and antiperspirants that people can buy that don't have aluminum. Now that we've learned that there are some risks, the producers of these materials have taken aluminum containing reagents out of the production of their material. So there's always options now because of what we've learned. When it comes to Teflon pans, nonstick pans, yeah, there's more risk with those for developing certain cancers. Um, but oftentimes it depends on whether or not someone's taking care of those pans, um, and ensuring that they're not overusing them to the point where, the nonstick is noticeably wearing off. So oftentimes when people have Teflon pans, they just overuse them, and it's important to buy new pans every couple of years if we notice that the wear and tear is great on them. And that's one thing that can help reduce risk, just being kind of like um, aware of the use of these materials, such that that you're not consuming the Teflon coating on these pans.
Yeah.
Yeah.
Yeah, makes sense. And what I find is that, the idea with microplastics is there's a lot of uncertainties about them. We don't necessarily know how big of a risk it is for, other diseases as well, like heart disease or
Yeah.
Alzheimer's or something like that. But, there's very easy and simple swaps you can make. Like you can just stop using plastic Tupperware and replace it with glass. And maybe every once in a while you occasionally have something in a plastic box. That's fine. But in the fridge regularly just use glass boxes. And with the pans as well, stainless steel pan is very good for cooking, and you just remove one risk factor completely by doing that.
Yeah. Yeah, exactly. And it should be, I mean, we say this as though it's a relatively simple thing to consider, but a lot of people and myself at
Mm.
some point haven't really considered a lot of these things too, and it's kind of just about what we do going forward.
Can you reverse some of the past damage you did to yourself? Let's say smoking, alcohol, bad diet, etc.
Um,
Specifically in the context of like cancer.
when it comes to undoing damage or reversing damage from past association with carcinogens, it's often very hard to do, and it often depends on what the damage is. So, for example, like if somebody's smoking for a long period of time and they've damaged their lung capacity because they've been smoking for a long period of time, your lungs are not good regenerative tissue, so it won't repair to the state that it was before. But your liver, as an example, is pretty malleable when it comes to tissue repair, and it's a pretty integral part of the liver is to be able to repair damage in a very quick way. So if somebody is drinking a little bit or they've stressed out their liver for a relatively acute period of time, the liver will have a greater capacity to reverse a process associated with damage than something like lung tissue. So it always depends on the type of carcinogen or the type of material that someone is associated with in relation to the specific organs that that thing affects regarding regenerative capacity. But I will say also that in general, when it comes to reversing a process associated with damage, it's oftentimes not that it can be reversed to the state that it was previously in, but more so that it's an adaptation of a new state to accommodate damage that maybe has been done that cannot be reversed, to circumvent it or get around the damage that has been done. There's almost
Mm,
there's very few biological processes that can revert back to a state where they can function the same prior to that damage, if that makes
gotcha.
sense.
Yeah. And especially something like smoking is
Yeah.
where it will have a bigger effect on that.
Yeah. But this isn't to say that people shouldn't, just succumb to the idea that, oh, I've already, you know, induced enough damage. I guess there's no point in stopping, right? Like
Right.
if you stop associating with those carcinogens, there's obviously a lot of benefit from a health perspective, even just focusing on that alone, in terms of trying to repair tissue to the best of the capacity, whatever that new capacity might be. It's not worth continuing to smoking or continuing drinking like crazy to, just because you've
Yeah.
already induced enough damage.
Yeah.
Yeah.
Next question, should I be tracking any specific biomarkers for cancer risk?
Um, it's hard to say because there's a lot of different types of biomarkers, but something that I've recently been doing and I think that a lot of people talk about online is, as we get older, as you get to about 25, 30 years old and onward, regular blood tests are important. not only from an endocrinological perspective in terms of, you know, checking estrogen, testosterone, T3 production from your thyroid, T4 production, those sorts of things, cholesterol, all those sorts of things are very important biomarkers, which can help assess whether or not there's something wrong. And it's not always cancer, right? It could be something like predisposition to heart disease if we see issues with cholesterol, as an example, or it could be something like testicular cancer if we see that there are severe aberrations in testosterone and estrogen signaling in males, or even females when it comes to estrogen metabolism. So those are important biomarkers. Most of the metabolic panels that you get from standard of practice blood tests are in general very good to assess
Mm.
potential for disease. It's just people need to do those things regularly. I would say,
Yeah.
if not every year, every 6 months.
Yeah. Even just to assess overall health and immune
Yeah,
system function and those things, inflammation
exactly.
status.
Yeah, because you get your white blood cell count and stuff with those tests as well. And if you see like an increased eosinophilic count, you could be indicative of an allergic response or some other issue with your immune system.
Mm.
So it's important to pay
Yeah.
attention to those things over time.
Yeah. I guess we can start wrapping up.
Sure.
And last question is: are there any supplements that have cancer preventive or protective effects?
It's hard to make a global statement about this because supplements are a bit taboo with a lot of people. But I will say, from like a nutritional perspective, there are a lot of supplements that people can be utilizing alongside their diet to help offset
Mm.
risks, maybe or even help to increase the efficacy of certain medications that they're taking. So in my own case, like I take vitamin D3, I take vitamin K complex. Um, I've taken ashwagandha. I currently have like a supplement stack. I've partnered with Blokes. I don't know if you're familiar with the company Blokes. They do blood tests and those sorts of things to help increase care towards men and women. But there's a variety of different supplements that people can use, whether it's something like ashwagandha or vitamin D3 or vitamin K. Omega 3s, healthy fat sources, those sorts of things can help to um, offset some sort of imbalances that a person might not be getting from their nutritional profile that they're getting on a regular basis. So um, it's hard to say how those things will contribute to reduction in cancer risks, um, because obviously the things that we eat are more complicated in terms of their relation to
Right.
cancers. But in the short term, they'll help to increase a person's nutritional diversity such that hypothetically they're reducing their cancer risk. But it's hard to say whether or not the consumption of that supplement is causatively linked, just because there's so many things associated with the things that people eat, that it's hard to say whether or not the impact of that supplement on the person's diet is directly related to cancer risk reduction. But I will say
Mm.
overall that if you determine in your blood panel that you're low in vitamin D3 or you're low in other vitamins as a part of your metabolism panel, then it might be wise to supplement those things to help offset those effects, because you may
Mm.
not be eating them in your nutrition. So
Yeah.
if you cannot find a way to get those things through whole foods, then supplementation can certainly be helpful.
Yeah. Yeah, exactly. Supplements, I don't think they're gonna, cure cancer or something like that. But just again, they might fix some potholes in your blood
Yeah.
work or your nutrition intake or something like that.
Yeah, exactly. Yeah, I mean, just as the name would imply, there's supplements. They're supplementary to the things that we're eating to help offset those potholes, as you mentioned.
Mm.
Yeah,
Yeah.
exactly.
Well, yeah. Well, it was great to talk with you, and thanks for answering all the questions. I think people will appreciate it. And yeah, where can people learn more about you and your work?
Yeah. First of all, thank you again for having me for round two. I'm always here to talk to you and your audience if they've got any more questions. There's awesome, awesome, awesome questions that were asked by your audience. So thank you to them, first of all, and yourself for hosting me today. People can find me On Instagram, I've got a website, drjoezondel.com, but people can find me on Instagram at dr.joezondel. Yeah, I'm pretty much most active on Instagram these days. I'm trying to span out into YouTube, but obviously I'm a one-man band over here, so all of the editing and stuff that people see is me, myself,
Hmm.
and I. So it takes a lot of time from my already very busy work schedule in biotech. So that's where people can find me on Instagram, and I'm always available to answer people's questions, um, particularly in the comment sections of my posts.
Yeah. Yeah, well, I appreciate it as well, and thanks for coming. We'll do another maybe future one in a few months or a year.
Yeah, sweet. Thanks, dude. I appreciate it.
Yeah, thank you.